It's been a year since the beginning of COVID in our country and our state. The medical community has been under so much stress that most have never experienced up until these times. Burnout, it has always been a concern in the medical field, but even more so now. One nonprofit has been educating and treating burnout in this area over the past year. And Dr. Clark Gaither is the medical director for the North Carolina Professionals Health Program, joining us now to talk about this critical topic, you could say, at this point in time. Have you seen burnout from a perspective in the medical community different from any other year this year?
Especially this year. Burnout rates were high and climbing prior to the pandemic. The pandemic has only served to amplify the symptoms of burnout and intensify all of the underlying drivers of job-related burnout. So we've seen quite a bit of increase and referrals to our organization.
And for certain, your group has been helping what has been going on, local hospital systems, try to identify and treat that kind of staff burnout. What are the signs and how do you go about helping it?
Well, there are three main underlying drivers, or rather symptoms of burnout, and that is emotional exhaustion, the development of cynicism or negative feelings, and a lack of a sense of personal accomplishment. Those are the three main symptoms of burnout. On an individual basis, we work with providers to help them get the resources they need to combat burnout in their own life. And we've been working with organizations, large hospital systems across the state, in identifying the underlying drivers of burnout and helping them to reverse the negative impact so that they can alleviate this problem.
And you say identifying it, but is this an unidentified problem in some cases? Because so many people go to doctors for help. You don't really go to the doctor and say, hey, doc, how are you feeling?
Right, and self-care is paramount. Providers are very good at taking care of others, but sometimes they are less good at taking good care of themselves. And a provider must take care of themselves in order to provide excellent care to patients. So a lot of times when people experience burnout, they don't really know what's going on. They just know something's not right and they don't feel good about their job or what they do. So my advice is to seek help. You can call NCPHP or you can check with the Employee Assistance Program at your organization. There's various online resources. The main thing is, though, is to reach out and ask for help if you feel like you're struggling.
Yeah, solutions, that is what we like to provide here, Doctor, and you have helped us do that, certainly, this afternoon. We all hope COVID goes away in time, but burnout is likely to stick around for a while, so it's something we'll have to keep our eye on. Dr. Gaither, thank you so much for your time this noon.
Thank you.